I'd like to welcome the next speaker. It's a good friend and colleague, Dr. Mushabbab Asiri. Dr. Mushabbab is a clinical radiation oncologist. He is the CEO of Proton Therapy Center at King Fahd Medical City. And also he's the director of the Saudi National Cancer Institute. Dr. Mushabbab has very impressive publications, and he's involved heavily in high-ranked national committees assigned to develop national cancer strategies. And Dr. Mushabbab is going to present us cancer prevention and management in the National Crisis Plan. Dr. Mushabbab, the mic is yours.
To be here with you, and special thanks to Dr. Ali Zahrani and Dr. Saleh Al-Uthman for inviting me for this elite gathering and elite conference, which came at the right time. I'll be speaking on behalf of Saudi Arabia National Cancer Institute, which is a part of Saudi Health Council, and I'm going to talk with you for the coming 17 or 18 minutes about cancer prevention management as part of the National Crisis Plan. In Saudi Arabia, up to now, there is 356,000 cases reported in our country, and thanks God, 345,000 people recovered completely from this disease, while there is 5,212 people suffering in either at home or in hospitals, and only 5,857 deaths. This number is not high, but always we like it to be less than that. And the case fatality in Saudi Arabia is 1.6%, which is almost half of the worldwide fatality of this disease. Form executive committee led by the Minister of Health. You can see him in the middle of the picture. What we call MERSCOV, where there is a lot of information coming from different sources, where they're going through processes and eventually translating the data or the raw data to proper information and decision and right decision. With an excellent infrastructure and IT, this is huge servers and huge backup processes and smart systems, data warehouse, smart analysis, proper cybersecurity, and extremely difficult proper integration for the system in different section of the health sector in Saudi Arabia. Through this processes, we have the National Command and Control Center. And the key strategies on national basis was based on science, recommended by scientists, executed by high officials, led by the Crown Prince and the King, and supported by the Crown Prince and the King. Decision was taken at the right time by cancellation of planned events, use of social distancing, travel restriction, voluntary home quarantine, change of funeral and some social activity, clear communication at all levels, and restriction of mass gathering at all levels, either sport gathering, celebration, even ourselves in oncology. Our annual conference was cancelled on last year, just the beginning of March, even before the national or international announcement of COVID-19 pandemic crisis. And you can see here in, how the government moved quickly, and this graph by National Health Economy section of the Saudi Health Council. The first cases reported in Saudi Arabia on the 2nd of March 2020, and just within 48 hours of the first case, Umrah was closed. Umrah was closed on 4th of March, and by 1 week of the first case, the date of the 8th of March, all education became remote, and the remote education started. This is even before, just 1 week before the WHO announced COVID as pandemic and international crisis. So I think Saudi Arabia take the right decision at the right time before the crisis build up. And I think we are one of the excellent country to manage this crisis at the right way at the right time. Even you can see the international flight was suspended on the 15th of March, and domestic flight suspended a few days later, and suspension of all activities, even work remotely, was started around 17th of March. So by the end of last March, all the right decision was taken and implemented, which is give us the right thing to be proud in our country, and the right thing to save lives of Saudis or people who's living in Saudi Arabia. And even the healthcare was is available for Saudis and expats equally. Talking about this, we have Wiqaya, which is the national center, or the Saudi CDC. And also this center was nicely with the collaboration with the US CDC, and the bond was strong during COVID and continued. And through this center, Wiqaya Center, there is many publication and guidelines at all levels. This is publication in Arabic and English for professional and for the lay people, bilingual for community, for the press, for the media, and also for the people who's working in ICUs, in front lines, in emergency room, and laboratory, and it's available at the right time. By the end of March, all this information was available for free and for the public equally. Cancer patients, they are special because they suffer from COVID. The majority of cancer patients, they are elderly, they are above 60. Patient with cancer show radiotherapy or systemic anti-cancer agent, but they are highly vulnerable. Fortunately, maybe 1/3 of cancer patients around the world, so they are at the middle of the storm, are highly vulnerable to have bad COVID-19 disease and unfortunately bad outcome. So we in Saudi Arabia National Cancer Institute took the lead and published our national guidelines by the middle of March 2020. We had senior consultants from all the health sector representative in specialized hospital and medical cities and comprehensive cancer centers, and from surgical oncology, medical oncology, radiation oncology, ID consultant 3 times, and we are going to update it soon, and hopefully that will be available in our website. We decide to have the 4 pathways to attack the people. Through education and isolation and proper management and proper support. And through that, we publish our guidelines, which is available in the Saudi Health Council website, and it's available for all. And it was also shared with our colleagues in the Middle East and was published in one of the elite journals. We think, and I am thinking always, that education of the people, whether staff, or patients or community is important, because decisions they will accept. And then we established a screening procedure. We wrote international standard precaution, and has to be implemented. We recommend for all the health authority and hospitals to have enough supply of personal protective equipments, and encourage using routine non-95 masking. This is early in March, even before there is literature supporting this, and there is evidence supporting this. And also by second week of March 2020, all cancer caregiver, they should have the N95 fitting test, and if they are not fitting, they have to use alternative method for isolation and protection. And also assigning staff to obtain the swab, and also one of very important part in any national decision and the processes to identify call center, identify phone number and call center for the patient, to have the proper information and to have easy access to information. Also, we thought at that time about preparation of a permit, official permit. We thought of lockdown and curfew, and there was a proper methodology for official permit and to cancer patient to walk through barriers during the lockdown. Also, we recommend for the facility to have a special procedure, for example, limiting access to facility one entry. So we have proper triage and proper screening, restriction of visiting hours and visiting people to the area, whether visitor or vendors or ancillary services, and provide education for the people at the right places, establish training processes at the chemotherapy the unit, radiation therapy the unit, and also OPD, and implementing distancing with at least 150 centimeters at all places where the patient waiting, whether in the front desk or infusion bay, wards. Those during ward round, that we encourage the medical staff to keep 1.5 meter distance during their ward round. In addition to that, we recommend to suspend all on-site in-person group meetings, like tumor boards and gathering, and to move to virtual meeting, and that is, this method is still followed up to now. Not only this, we encourage use of telemedicine, and we are lucky in Saudi Arabia that we have telemedicine processes even before. Some hospitals they implement this even before the pandemic, and I think all of us trained, and we are convinced that telemedicine to continue in the future, even after the pandemic and after the crisis, because it ease the visit to the patient and ease the travel and make the life of cancer patient easier. Because of telemedicine services, there was a need for refill services, virtual clinic, and also to educate and train people, whether they are a staff or a patient or relative, to use the telemedicine processes through available application. Again, education isolation was implemented widely in cancer care unit, and people instructed to follow it orthodoxly. So any patient triad and have symptom will be isolated from the day 0, and proper procedure followed. We publish initial guidelines for measurement of cancer of a patient with the two troubled cancer and COVID. And at the beginning, we thought that all the patients who have cancer and COVID at the same time, they should be prioritized. So cancer care should be delayed for the 2 weeks, for 14 days, while they are recovering from COVID. And also, in the beginning of the crisis, we recommend all cancer patients to be admitted to isolation wards so they can be followed closely. And if anything happened, they will be managed within the right time. This now is not followed orthodoxly, because now some cancer patients, if they are asymptomatic, they usually ask to stay at home, get isolated, but they have full access and easy access to the hospital if their case deteriorated. But initially, we recommend all cancer patients, whether they are symptomatic or asymptomatic, to be admitted and isolated till they became swab negative. Also, there is specific management guidelines for the staff. We recommend that all cancer patients who get COVID to be isolated and served by the same group of staff. And this staff should not mix with other staff who are taking care of non-COVID cancer patients. And that was acceptable. So in each cancer center, they assign a certain group of staff to take care of cancer patients with COVID. And these staff should not mix with other staff. They should leave the hospital once they finish, and they have to be 3 days at least free of any symptom after their rotation finish with cancer patient. After there is a lot of patients with cancer and COVID, the hospital also start to treat some cancer patients even while they are positive for COVID, is for non-immunosuppressive treatment like radiotherapy. So they were implementing the guidelines of infectious disease to treat these patients at the end of the treatment sessions and take the right precaution. But for chemotherapy, most of, I think all cancer centers in Saudi Arabia do not treat COVID and cancer at the same time. They have to be cleared from COVID, then they could continue their cancer care. There is priority model implemented, and we adopted the model by King Faisal Special Hospital. It is nice priority model, and it was adopted national wide, and that guide the treatment management of cancer patients, because at the beginning of the crisis there was thought of delaying all non-urgent cancer cases till the things improve. But after we haven't noticed proper. We thought at the beginning that maybe crisis will continue for 2 to 3 months, but unfortunately now we are almost 11 months and still more people infected. So cancer patients, they should continue in treatment while there is a crisis. And proper management guidelines was published for management of cancer and also management of COVID-19 infection on cancer patients. After April of last year, there was accumulation of patients who been canceled because of the crisis, especially in the surgery, and because we have proper data. If in Saudi Arabia was in a British Journal of Surgery, that we reported thousands of cancer patients with cancellation of their surgery because of COVID. And at that stage, the minister took the lead and instructed all the hospitals to ease in the restriction for cancer patients to have treatment, and to ease in the use of OR for cancer patients, because there was initially there was ban of all cancer elective surgery, but since April or May, I forgot the date exactly, cancer patient came back and have their surgery after being screened. But there was a screening process before they get their treatment. We in the Saudi Health Council also took initiative to educate the people and to make clear information for them about management of cancer and COVID in cancer patient, and it is available on our website. I think Saudi Arabia was very successful managing this crisis, and we are praying to Allah to protect all the people from this disease. And alhamdulillah, we have now good news. There's vaccines, and even health immunity also building up, and probably, inshallah, as we've been informed, that Saudi Arabia will be one of the first country to receive vaccine, whether from Europe or from West or East. And I think we should be proud of our country, and I think we made an excellent model for managing this crisis with a proper management and procedure, leading to one of the least fatality in COVID-19. Thank you very much for listening. This is the link for the Saudi guidelines, which is available on Saudi Health Council, and we'll be more than happy to receive your questions either now or displayed email. Thank you very much again.